What is early gastric cancer, EGC? Imagine catching a problem early enough to have a much better chance of fixing it. That's what early gastric cancer is all about. It's a stage of stomach cancer where the tumor is still very limited in size and depth. Specifically, it stays within the innermost layers of the stomach wall, called the mucosa and submucosa. This means the cancer has not yet invaded deeper layers or spread widely. Whether or not it has spread to nearby lymph nodes, the key point is that it remains in the early phase. Early gastric cancer often doesn't cause noticeable symptoms. When symptoms do appear, they are usually mild and nonspecific. People might feel indigestion or a sensation of fullness after eating only a small amount of food. Some might experience nausea, mild stomach discomfort, or slight weight loss. Because these signs are common with many benign stomach issues like gastritis or ulcers, early gastric cancer can go unnoticed for a long time. In countries like Japan and South Korea, where routine screening programs are common, early gastric cancer is detected more often. This early detection leads to much better treatment outcomes. In regions without such screening, stomach cancer is usually diagnosed at a later stage when symptoms become more severe and harder to treat. The main way doctors identify early gastric cancer is through an endoscopic exam, which involves inserting a flexible tube with a camera into the stomach. During this procedure, tissue samples or biopsies are taken to look for cancer cells. Imaging tests help determine whether the cancer has spread, but by definition, early gastric cancer is confined to the superficial layers of the stomach wall. Recognizing early gastric cancer is important because it offers a better chance for successful treatment. When caught early, options include removing the tumor through surgery or using endoscopic techniques to excise it without major surgery. The goal is to catch the cancer before it invades deeper tissues or spreads extensively. In summary, early gastric cancer is a form of stomach cancer detected at an initial stage when the tumor is still confined to the surface layers of the stomach. It often causes few or no symptoms, which makes screening and early diagnosis crucial. When identified early, treatment options are more effective, and the chances of survival are significantly improved. If you have concerns or risk factors, it's always best to consult a healthcare professional for personalized advice and appropriate screening.